Hello, everyone, and welcome to the Future of Healthcare, Human and AI Collaboration. I'm Chan, your host from Random Walk. Happy to see participants joining us from different corners of the world. Whether you're starting your day with us or winding it down, we're thrilled to have you here. Now, cutting to the chase, it's not news that healthcare faces immense challenges. Costs are soaring, resources are stretched thin, and the demand for top-notch care is ever growing. The stakes couldn't be higher, and amidst these challenges, we need to innovate and fast. You've seen AI revolutionize industries like finance, manufacturing, and retail. But in healthcare, we're just scratching the surface. Today, we're here to explore how AI can be the game changer we desperately need. To guide us through this discussion, we have two leading experts from their respective fields. Dr. Venkita Suresh, with more than 4 decades of experience as a senior consultant in internal medicine and cardiology. He brings a wealth of expertise to the table. He's currently the Group Medical Director at Carver Group of Hospitals. Joining us all the way from Australia, Amir is the CXO and Head of Applied AI at Academy XI. They're a global leader in digital skills transformation. Amir specializes in devising AI strategies and growth plans for organizations. He's also a university mentor and a global leadership mentor. Amir and Dr. Venkita, we're thrilled to have you here today. I want all our audience to participate actively. If you have any questions at any point during the webinar, simply type them into the Q&A section. You will see a question mark symbol on your screen. We'll be pausing in between for questions, or if you prefer to ask your questions verbally, simply raise your hand and we will unmute you. I know you're all waiting to get started, so Dr. Venkita, with your extensive experience, you've witnessed the evolution of digital transformation firsthand. Can you tell us some of the biggest milestones and why it's vital to keep up with the changes?
Thank you, Chan, and thank you all for finding time to be with us. I'm most grateful. I'm a bedside doctor who takes care of patients. Therefore, my talk will be very, very simple. I shall not use jargon. I promise you I shall be extremely brief, giving you time to reflect and ask me what you have in mind. So I would be talking exactly like a doctor who wants to do his best for his patients. So I'll be addressing how does AI help my patient and how may AI help me to be a better doctor. So we hear of digital medicine, digital health, transformation, and all those words. They actually mean quite simple to a doctor and a patient. Digit, as you know, refers to your finger. So obviously numbers are involved in digital medicine to a large extent. We are looking at a lot of data that involves numbers and also text. Now, the first thing that you hear is digital health. The simplest thing is that we are using the technology to spread information, learning, to put data into patients' hands so that you are in control of your data. And it's about wellness. It's about being healthy, about managing your sickness if you happen to have one, and then be in control. That is digital health. For example, your smartwatch that tells you your SpO2, your heart rate, shows you an ECG, and in case you have an abnormal rhythm, it tells you to take a ECG and send that to your doctor. And so many other machines that help you check your BP, check your blood sugar. So all these variables, as you know, they're all in your hand. It put control into your hands of your digital future, which means your data you generate, it's your data, you share with me, and together we address your concerns. That is digital health. We call it M-health and E-health. All of them use technology to help you to look at your health data and share that to healthcare provider. That is very easy. The next one is a bit more complex. We got to digital medicine. We're talking about technology being used to diagnose, to treat, to prevent, and manage disease. And that is what we're looking at in the future. How would digital technology help us to diagnose better, to treat you better, to prevent your illnesses, and manage your disease better? That is digital medicine. The next thing you hear is digital transformation. That is where AI comes in. AI is coming in. It will transform everything in the way that we do medicine. And last word you hear is innovation in digital way of life. That is more and more innovations to make the patient's life better, the patient's illness manageable, to give control to patients about their life and disease, and work along with patients to manage their illness. So AI does not come to replace a doctor. It doesn't come to make your life more difficult, complex, and expensive. It comes along to make things more efficient for both the patient and the doctor to manage an illness. So forget the keyboards, forget the huge amount of data we type in. We're looking at giving the doctor the time, the gift of time. This is what Eric Topol calls it. AI will liberate the doctor from many unnecessary chores and troubles to devote time to the patient, so that the patient comes well informed with all their data. And the patient's data is what the doctor would work on, and avoid distraction of any kind which takes away attention of doctor from the patient across him. So AI in medicine is all about making patients' life better. A digital future is all about bringing patients and doctors together and making that a very happy, a very productive, very healthy, and a very heartwarming association. Thank you, Chan. Over to you.
Thank you, Dr. Venkita, for setting the stage. Now, let's shift gears and talk about the future. Amir, your expertise in AI makes your insights incredibly valuable. Could you shed some light on the potential of AI in healthcare? How do you see it shaping the future of healthcare?
Absolutely. Thanks, Chan, and thank Dr. Venkita for setting the stage. Look, any new solution in any industry often should put the user or the human at the center, right? So if we think about AI, we think about cryptocurrency, we think about virtual reality. It doesn't matter what the technology is. It's all about, does it solve the problems that Dr. Venkita has just mentioned? Increase the quality of health, reduce errors, improve research in medicine, and make the lives of practitioners much easier. So now, if we think about AI, I think what's fascinating about it is that it has had the highest rate of adoption of any technology in humankind through a human evolution. As the biggest adoption. And if you think about the ease of which the current tools that we see, from ChatGPT to Google's Gemini to all the other tools that we see, they're so easy to use. There's almost no excuse, right? If we think about what you can currently do, you have inputs and outputs of technology, right? At the moment, the flexibility and ability to use AI to provide an input in text format to get text out, to put text in to get image out, from image to text, from image to image, from voice to text, from text to voice, 3D and animation, translation, all these services are so powerful that there's almost like no excuse for any industry to be able to use it. I guess the challenge often you find in industries like healthcare or even financial services is that because they are so heavily regulated, often regulation is seen as a way to stifle innovation and therefore block new technologies coming in. But as Dr. Venkita mentioned, and I've got some examples that I can share later, and these technologies, when used in an ethical, safe way, which again is probably another topic we can cover, can do wonders in terms of improving healthcare for patients and for practitioners.
Fascinating insights there, Amir. It's really remarkable to see the potential AI, holds in transforming healthcare. Now, before we move forward, to all our audience, you'll have a poll question popping up on your screen. We want to know how comfortable you are with the idea of AI collaborating with healthcare professionals in diagnosis and treatment. So please take a moment to select your response, and I'll come back to the results in some time. So as Amir and Dr. Venkita said, AI holds incredible promise. However, to fully realize its potential, it's crucial to address the barriers patients often face in accessing timely and quality care. Dr. Venkita, we'd like to hear your insights on the specific challenges patients encounter while navigating the healthcare system.
Right, Chan. Globally, patients are unhappy about a very important fact that they get little time with their doctor. The time is roughly about 7 minutes. An average patient gets time to talk to a doctor, which means there is not enough time for a patient to convey all his concerns, his worries, his anxieties to a doctor who will not listen because he's typing into the same time into the EMR. So the idea of AI is to bring back that connection, that face-to-face conversation, more effective and more meaningful and more productive, which means that the patient has now an opportunity through AI to talk to a chatbot first, for example, they can try out all their questions and concerns. They can divulge their history, their predominant problems and concerns. They can share their investigations, share their images, share their data. So AI begins to collect and synthesize all your data and prepares that for your doctor. When you meet your doctor, he already has a well-synthesized summary of your past history, your present history, your major worries, major concerns, your medical history, your ancestral history, even your genomics, even your economic, your way of life, where you live, the risk that you face in the environment. So your data, your highly personal data, is already synthesized and available for the doctor. So he can spend more time with you, listening to you, talking to you, explaining to you, examining you, and together making a plan for diagnosis, for investigation, and for treatment. That is the essence of AI. The AI becomes a tool. Put in a simple way, it gives a doctor more time to be a doctor. And technology takes care of all the other ancillary supporting services the machine can do better, which means a doctor becomes more human.
Excellent points there, Dr. Venkita. Amir, anything you'd like to add here?
I 100% agree. And again, if you listen to Dr. Venkita, the recurring theme that comes through is that the patient is in the center of all the decisions, right? Technology plays a peripheral, relationship between the doctor or the practitioners and the patient, but patient outcome is, right in the center. And that's what, in effect, what healthcare is all about, right? Patient outcomes, patient improvement, and advancement in medical research.
Absolutely inspiring. It's really inspiring to see how AI can bridge this gap. Now, coming back to the poll results, we asked the audience how comfortable they are with the idea of AI collaborating with healthcare professionals in diagnosis and treatment. Can you guess the results? Positive or...
Is it a concerned audience?
So about 64% expressed their discomfort. Now, Dr. Venkita, you've talked about the AI-human partnership. Can you explain how this collaboration works? Maybe we can reassure some of the audience who thinks that AI might be replacing doctors.
Right. Again, each one of you who may have any doubt about AI, I would suggest that you look up the doyen of AI, Dr. Eric Topol, who is a cardiologist in the US. He's the chief editor of Medscape, and he's the doyen of AI in medicine. So he is very clear that AI is entirely patient-focused, and the AI's main objective is to make the doctor available to you, his time, his intellect, his expertise, his ability, his skills, all for you, and give him all the data he needs, your data. That is what is the essence of AI. So please forget for the moment the irritating keyboard in front of your doctor. You are talking to him. He's looking at the keyboard, looking at the screen. This is what ruined the doctor-patient relationship all over the world, which why doctors don't like electronic medical records because they can't even look at patient eye to eye. They are looking at the keyboard or the screen. That did quite some damage. So AI will free the doctor from the keyboard and give him time to look at the patient eye to eye, listen to the patient, look at the data, discuss that data, and then plan a diagnosis and plan a treatment. Assisting a doctor to make a better patient-doctor encounter experience.
That was very informative, Dr. Venkila. Thank you. And I think that should reassure many who fear AI might replace doctors. Like having a GPS in your car, it doesn't take over driving. It simply guides you to your destination, making the journey smoother. But of course, there's self-driving cars now. So I don't know if I'm giving you the right example. Before we move forward, we have another quick poll for our audience. We want to know what areas of AI in healthcare you feel you need the most information about. The poll should reflect on your screen any moment now. Please select your response, and I'll circle back to the results in some time. Now, let's take a few questions from our audience. If you have any questions, please raise your hand so we can unmute you. Or I see that some people I see some questions popping up in the chat. We can pick it up from there as well. Okay, so here's a question. In my hospital, the data is not centralized. It spreads across departments in various formats. Many things are in silos. In this context, where should we begin our AI journey first? That's an excellent question and a common challenge. Amir, could you give some guidance here?
Sure, I definitely can. And that's a really, really good question. And I think that the person who asked it nailed it on the head. The biggest barrier to adoption, or from an enterprise and organization's perspective, is data. So often data is not centralized, it's not governed, it's not managed correctly, it's unstructured. And to have good artificial intelligence tools and systems that are supporting practitioners and hospitals, you need to have a good data. So in terms of where to start, often that's the start of the journey. Obviously, there's capability upbuilding, there's building ethics and frameworks, which again, I can share later on. But in terms of starting your journey, in terms of building a solution, the first step is get your data house in order, right? Centralizing it, cleansing it, make sure any personal identifiable information is anonymized or removed, tagging the data, and to then be able to train those AI models using that tag data to be able to then inquire and generate insights at the back of them. Everything else often comes second. Building the technology, it's quite accessible, right? You've got platforms that you can sign up to, you can build your own models, you can use open source models. That's not the barrier. The barrier is often that organizations don't have the data or don't have the data in a format to start, and hence they don't start. They just go around circles. So it's a really, really good question. And I would say that is probably the biggest barrier to start with, is centralizing and cleaning up the data before building systems around it.
Thanks for the guidance, Amir. Now, coming back to the poll results, we asked the audience which areas of AI in healthcare they needed the most information about. And it's clear that majority of them are eager to learn more about the compliance and regulatory side of AI in healthcare. Dr. Venkita, as someone deeply involved in healthcare leadership, we're curious about your take on the regulatory challenges. For organizations that are looking to adopt AI, where do they get started? How do they get started?
Dull area to talk about, but yes, it is important. So all over the world, people since the anxiety about AI. What exactly is AI? How will AI will influence my life, my patient's life, my practice, my income, my patient's loyalty to me? So there are a lot of questions regarding AI in the minds of people, and also safety of patients data, privacy, and the occasional hiccups in AI called hallucinations, confabulations. Bias is an important problem in the West. In India, we don't worry much about that. So there are many concerns in AI, and every one is addressable and solvable. Let me take most important. Anyway, so broadly, WHO already announced their universal and global regulations on AI. Mr. Biden has already announced the USA's policy on AI. India announced already the Indian policy on AI, and Europe is already ahead of us. So almost every single country has already announced and published their regulations on how they will regulate AI. But there's two important aspects there. What do you want to regulate? Do you want to regulate the process or the outcome? That is the most important question in regulation. If you regulate the process of AI, then probably you will affect innovation. You will interfere with brilliant minds working on to improve AI in every single way. Let the process be left to people's imagination, their innovation, their ability, their enterprise. But the outcome should be very, very strict. And there is one single question: how does AI affect patients' outcomes? That is the most important question where we have regulation. We must be able to prove scientifically, accurately, numerically, how do patients benefit and how do their outcomes are influenced favorably by AI and unquestioned by AI. This is the idea of regulation. And I think people are doing a good job. Many countries are already fully aware of the need to regulate AI, but they must regulate not the process, they must regulate the clinical outcomes. Or does any new innovation in AI to deliver ultimately good patient outcomes? If you insist on that, we are on a safe path.
Thanks for sharing your insights, Dr. Venkita. And as we move forward, understanding how organizations can navigate these complexities, I'm sure will be extremely crucial. Now, we've got to address the elephant in the room, culture, right? I'm sure this will resonate with many of the leaders who are present in the webinar today. We all know that shifting gears in organization isn't just about adopting new technologies, it's also about changing mindset. Amir, you work with organizations around the world, especially with leadership teams. How do you overcome internal resistance to adopting AI within healthcare organizations?
So if we again think agnostic of technology, right? In the technology space, which I've been working over 25 years, there's a notion or there's a theme called the customer adoption curve, right? And every technology follows the same curve. Think of it as a bell curve, where you've got your early adopters followed by early innovators and early adopters. And then when it hits mass population is what we call the early majority and late majority. And that's where 80 to 90% of adoption of a technology takes place. As fast as AI is currently going, many organizations are still either playing with the tool and call themselves early adopters or innovators, or they've got their head in the sand and therefore they're not even considering the technology. So I guess the biggest way that we recommend of adoption taking place is starting small. Right, the person's question around data sovereignty, data quality. Often organizations, and let's take hospitals and healthcare, often go, right, we need to do it perfect and we need to do it right at the very start. Sure, we need to be ethical. We need to make sure the data is safe and secure. But the perfect opportunity to use such technology is to be able to experiment. So instead of thinking about your entire hospital's data, maybe take one department's data and try and experiment and build a solution for that. Right? Think about the problem you're trying to solve. What are the pains and gains for patients? What are the pains and gains for practitioners? Look and identify those challenges and problems and go through a product development life cycle to build a small solution, a prototype, a proof of concept. And often what happens is when you do that and we can show the proof points and the use cases and the benefit to the end, the consumers, the patients, the doctors, often that becomes a catalyst to break down the barriers for adoption. 100% to Dr. Venkita's point, governance and regulations is extremely important. And across the globe, there are bodies who are already building, frameworks for the ethical use of artificial intelligence. The United Nations has a set of principles that are loosely, bound by human rights. Things such as do not harm, safety and security, fairness and non-discrimination, human, autonomy, oversight, transparency and explainability. These are just some of the principles, right? These are already there. Frameworks already exist. Some are voluntary, some are mandated, and then obviously we've got laws, which, for example, President Biden's executive order sort of follows through, and the EU Act has, was signed late last year. So those will come, but if organizations are going to wait for those laws to come into fruition, it's already too late. there's so much opportunity to solve healthcare-related problems. Some frameworks already exist. And I think organizations need to take it upon themselves to explore those technologies, build some principles and frameworks, get advice from a legal perspective and technology perspective, and just jump in. I've got a bunch of examples that I was going to share, and I'm not sure how we'll go for time, in terms of what artificial intelligence has managed to do for the healthcare industry. And if I just share some of those examples, I think it becomes a no-brainer as to, I guess, the benefit artificial intelligence can have for this industry.
Excellent point, Sir Amir. Really insightful thoughts, especially for the leaders who are present in the webinar today. Amir, I know that you were interested in sharing some case studies about AI in healthcare. I know we're pressed for time, so quickly moving on to you, Amir. Please share your thoughts.
So obviously, Dr. Venkita has already mentioned where AI can be used for note-taking between patient and practitioner. That's a no-brainer. Speech-to-text technologies already exist. They can be used safely, keeping the patient's data secure. But there's some amazing advancements that happened over the last couple of years. For example, back in 2022, researchers developed a machine learning algorithms, basically, which is driven by AI, to drastically improve sepsis detection in hospitals, right? Leading to diagnosis 2 hours earlier and reducing hospital mortality by 18%, right? Predicting the next variant of COVID. Researchers used 6.5 million sequences of COVID-19 virus in a computational model to identify the next mutation pattern. This actually led them to detect the next Omicron's BA2 variant before the global outbreak and prevalence, which helped public health programs to be able to prepare, anticipate, and plan. The FDA in America has just authorized the first AI-powered medical device designed to help physicians assess skin cancer, right? Drastically improving detection in terms of accuracy. Stroke victims, this technology that's driven by AI and researching in UC Berkeley in the US have devised that allowed someone who suffered from stroke and hasn't spoken for 20 years to be able to speak. Right, 93% accuracy in ovarian cancer detection. The researchers have developed a machine learning tool that allows them to do that. This tool basically provides a probability of cancer presence rather than a sample standard yes and no that currently happens. And there's a startup in Australia called Prospection that helps in terms of getting the right patient on the right medical treatment, helping pharmaceuticals through analysis and artificial intelligence to be able to match the patient to the right medicine. Like, these are just a very quick sort of examples that I've managed to curate. But going beyond just patient and doctor, if you look at some of these examples, and there's many, many more, you'll be easily convinced that artificial intelligence, when it's done right and when it's done ethically, has a huge positive impact on the healthcare industry, saving time, improving patient outcome, fast-tracking medical research, just to name a few.
Very interesting insights there from you both. So both our experts here today have made a clear case for AI and its potential in healthcare. Now the question is, what next? How do we take these insights and translate them into actionable steps? To help us navigate the path forward, I'd like to invite my colleague Prabhu. Prabhu, over to you.
Great. Thank you, Chan. Good evening to all. Hope you are having an insightful session. Let's see now how we can turn the insights to an action. Just stay with me for a few minutes and try and follow, and then you can try that post the session, where we would start with getting to our website, www.randomwalk.ai, where you should find our AI Readiness Index tool placed in the services menu. Click onto that, and you should be taken to the assessment page. Basically, this is an assessment to understand the AI maturity of your organization, where this is done with multidimensional. So this is going to help you understand the key areas of improvement as well, where you may need to spend 5 minutes of your time, and post the assessment, you will be able to generate a report, which you have to share it with us. And you can share this to our inquiry@randomwalk.ai, where you can also set up a one-to-one consultation where our experts will connect with you to make you understand about this report and as well help you to understand the possible next steps. And for more information about our training workshop, you can visit our website and as well as inquire back to us with the inquiry at randomwalk.ai email ID. And at last, we suggest that this is the high time that you should make your first step towards AI. And we are there to support your AI initiative. And more importantly, AI is not just a technology, and AI is your enabler.
Valuable information. Now, I think we can just pause here and pick up a few questions from the audience before we wrap up. If you would like to ask any question, please raise your hand and we will unmute you. What advice would you give to healthcare professionals who are interested in learning more about AI? Amir, because you come from training background, I think I would like your insights here.
Yeah, 100%. And I've just put a quick response in the Q&A. The best place you can start is some fundamental training, right? There's plenty of training that Random Walk can do in partnership with ourselves, and just to understand the basics of things such as hallucinations that Dr. Venkita talked about, some existing case studies, some of the tools that are used both in healthcare industry and non-healthcare industry, the ethical frameworks. So there's some basic knowledge you can do, and then in some of these training, you can go on to actually delve deeper into the context of your business. Which are you a hospital? Are you a GP practice? Do you work in palliative care? Some of those workshops can help provide some context and some use cases that you can take back to your business and consider building business cases around. But definitely get some training and remove the fear and start to understand how these technologies work, I think is the very first step.
Thanks, Amir. We've got one more question. How do you ensure AI-based diagnostic tools are validated and reliable? Dr. Venkita, your insights here would be really helpful.
Right. So as a seasoned clinician, dealing with patients, you would have the insight to know whether the output of the AI tools that you're handling are scientifically valid and scientifically grounded. So the tool assists you in making it more efficient. It'll give you a large number of tools in the future. And it'll also enable the patient or the person to have their own tools. You will have, anytime now, you'll have a retinal scope. You have the ability of a smartphone to take a retinal photograph, the ability of a smartphone to do ultrasound or an echo, and send, like an ECG being done now, and send that for interpretation and to your doctor for further discussion. That is from the patient side. A number of things will be made easier. For example, talking to a chatbot, you can clarify a large number of the questions and get appropriate answers. And again, a patient would sense instinctively, are the answers appropriate? Are the answers logical? Do the answers address your concerns? And then is anything, and what is not covered there, doctor can help you. So it's a mutually enriching process, so that we and patients and doctors will be a part of improving AI all the time by giving feedbacks to the system. So it gets better and better and better. AI brings to the patient, to the doctor, the institution, and the science several advantages not there in the past. For the patient, it enables the patient to have a hand on his data. He should have all his data with him and a hand on how his data is being appreciated, evaluated, and acted upon. Today, a patient is passive and the doctor is active. So a time would come when the patient is a co-player in the discussion that goes on, which comes to a good conclusion. To the doctor, it takes his hand and time off many unnecessary waste of his time, brings him back to the patient to address the patient's concerns and get the best possible diagnosis and the best possible treatment. For the institution, it becomes an efficient process. For research, it's a big opportunity because you can handle volumes of data Tomorrow, AI will have the computer vision of AI can quickly screen thousands and thousands of CTs, MRIs, pathology slides, hematology slides. A number of information can be screened by the AI and given you a summary within a fraction of a time. It will take you months and ages to go through all the data by hand. So in many different ways, the efficiency which comes in would help the patient, the doctor, the institution, and science in many, many big ways. But we're part of that. We have to be in control, and we have to guide that process and get that work for you. AI does not work, that does not run us. We would be on the hands on the steering wheel, and we make AI work for us. That is the way.
Thank you.
Look at that.
Thanks, Dr. Venkita. I hope that answers the question. I've got an audience, Dr. Adnan Mohammed. I'm going to unmute you, so please go ahead and ask your question. Dr. Adnan?
Able to hear me now?
Yes, we can. Please go ahead.
Actually, both of us have joined with the same invite, what Adnan has got. So Dr. Adnan is with me. I am Dr. Anand. So we are joining you from the new unit of our Kaveri Hospital. I was just interested in two of the aspects. Has AI become? Can we afford AI? Like we are a developing country, so has it come into the affordable range? That is one thing. Number two, regarding these electronic medical records and the artificial intelligence, is there any definite policy which has been formulated at the governmental level so that it will be standardized throughout the country? Because once that drive comes in, I think that will also help us ease. And if it is going to be, cost of all this is going to be centralized as a policy from the government side. I know there are a lot of limitations for us in India, but should it come from top down so that it will be standardized across instead of each and every private player investing into these things? Because even if we invest, it's not going to be standardized enough, and we need to extract data from this for future health planning. So I just wanted to have some inputs on these two things, because
answer the first part around the cost, and it's a really valid question. What's amazing about the current technology around artificial intelligence is the adoption. And the reason the adoption is so high because the cost is low. The entry to using such technology is really low. And the reason it's low is you've got organizations like Google, Amazon, Meta, OpenAI. They've spent millions and millions of dollars, obviously backed by heavy investment, to build these large language models and other technologies so that you can just spend $20 a month and get access to those systems, or get a subscription model on other platforms that are built upon these technologies to be able to make use. And if you actually want to go and build your own technology, build your own large language models and build your own application, that's very expensive. It'd take you many, many years to train that information and that data. And that's why these organizations exist. Now, you can either, support the proprietary sort of industry, you can go to open source, or if you wanted to, you can use your own. But the cost to enter this space is much lower than other technologies in the past. So price and cost shouldn't factor in. Is often to your second question around the regulations, the laws, and the frameworks that often governments are still falling behind in terms of providing. So hence organizations wait until those laws are passed before they actually adopt this technology. And in my mind, that's probably a bit too slow.
Huge shout out to our expert speakers. Thank you, Dr. Venkita, for generously sharing your wealth of knowledge and experience with us. And Amir, your energy and passion for AI is infectious. Thanks for staying up way past your bedtime, Amir. We couldn't have asked for better experts to shed light on the future of healthcare. Thank you both very much. And big shout out to our audience for joining us today. You'll have a poll popping up on your screen now. Please share your feedback real quick. And again, connect with us on LinkedIn, Random Walk AI, for updates and announcements about upcoming webinars. And if you're interested in training, please do check out our website. Thanks again for joining us today. And until next time, stay curious and keep exploring. Thank you, everybody.